Bevan, a couple questions. First one, MPS is going around cleaning schools. Does that help at all?
Well, the Centers for Disease Control's new guidance has been that schools that have been closed due to this current outbreak would use the same materials they use to clean to look at areas that are likely to be heavily traveled and frequently touched by students or staff. So the CDC is recommending that. I think that's a good, prudent effort. But their cleansers should be nothing more than what they use for the normal cleaning that they would conduct at those schools. So that is advised, and I'm happy to see that the school district is taking that action.
So were you telling, and I think it's what you said, that any kids at any of these schools should not be congregating together, or just kids that aren't showing signs?
Well, we want to minimize the recongregation of individuals in these schools that have been impacted. So as they go home and they sequester themselves and they wait through this period, we want their parents and guardians to watch those symptoms to make certain that they're not exhibiting any signs and to call their healthcare provider if they do see that they're doing that. But to recongregate during this period of time where we're looking to, one, make certain that those who have been impacted get the appropriate treatment and follow-up, and two, wait for the incubation period, it's not advised. We'd like to have social distancing be a part of every prevention strategy when we're dealing with a novel virus and influenza in general.
Are you guys talking to area school districts like Whitefish Bay, for example, about things that they're doing in terms of school closings and things like that?
Well, certainly we are always in contact with our local public health partners and the state of Wisconsin. We're having conversations with them daily, and the region is impacted. We know that disease is circulating in Wisconsin. It would be less than smart to assume that this has not left Milwaukee City and Milwaukee County. We've had dialogue with our colleagues, certainly not that community in particular, but we're constantly in communication. We're on conference calls almost daily with all the local public health departments within the state, and we're all on conference calls with the Centers for Disease Control.
Do you know how many people this affects, how many children in these 21 schools and daycare? And then, Mr. Mayor, maybe this is for you. What advice for parents who maybe have to take, to deal with these hardships? Is there anything the city is doing, can do, social services out there?
Again, I'm very mindful that this causes hardships for parents, for teachers, for other staff members at these schools. And I would hope that employers would be sensitive to this, to the challenges that it's causing the people who live in the city and whose children attend schools in the city. So that would be my request for the employers to do what they can to help these individuals out.
Do you guys have any idea how many children this would affect?
We can get you that number. We certainly will have that number, but what we wanted to do as we went through, what we wanted to do is check these schools earlier today to make sure that the children who had tested as probable actually had been in attendance at those schools. But we certainly will get you the count for the numbers.
They obviously had been recently in attendance.
Yes.
Do you have anything to say? I mean, there's people back here, there's a group of parents who are disappointed because their kids can't go. I guess they put a bunch of money down to go to Boston for a trip for the students.
Oh, I would be very disappointed. I'm sure they're disappointed. And I think every one of us here would be disappointed. If you've been planning for something, I saw one of the young men on television who said he had been working at his paper route for several months and was able to save money, and I congratulate him for doing that. And I'm hopeful that they'll be able to reschedule the trip and that the airline will be sensitive to that. So I'm hoping that they can take the trip. As I watched the trip, or the potential trip, I thought it sounds like a great trip, and I'm hoping that they'll still be able to do that.
But why do they have to cancel their trip? I mean, they all say that the group, that this doesn't affect the 17 or 18 kids. They're being, I guess, I don't know if it's prudence or punished.
Well, and I think that's in the eye of the beholder. The public health department here has made a decision based on what they have seen at the school that those young men and women attend. That this is one of the schools that is covered by the order that it has issued. It would be very difficult for us to say, well, we like these kids, we don't like these kids. We're not doing this to punish anybody. We're trying to do this so that more people don't get sick. And I hope people understand that. And again, I want to reiterate this. I am hoping that as the days pass, that what we will see is we will see less severity, fewer numbers. I don't know that we're going to see fewer numbers, but I am hoping that we will see less severity so that the guidance that we follow from the Centers for Disease Control will allow us to back off from this. So people should bear in mind, this is not something that I and the staff at the Milwaukee Health Department have decided we should do. We are following guidance from the Centers for Disease Control, from the State of Wisconsin Department of Public Health, Division of Public Health, and are working in conjunction with them.
You guys have repeatedly said that you're focused on school-age children. Of the 54 probable cases, what percentage of them are kids?
This new case count update is literally hot off the press. Our laboratories, state lab and children's labs confirmed those earlier today. That demographic work is being conducted now by our epidemiological team, so we don't have that distribution. What I can say generally is that we've seen school-aged children, and we've seen case counts start to affect older adults, and so it's the spectrum. But we're starting to do that. After these tests are confirmed, then we go and we find those individuals.
So you say more adults are getting affected?
No, I said we have the spectrum. We have school-age kids and we have adults, so it's an entire spectrum.
The gentleman back there is first.
Yeah, I have a question. I don't mean to be mean-spirited in saying this, but you were at Wedgwood Park IB School for its opening and the ceremony that they had. Mr. Andrikopoulos, the superintendent of schools, was also there last week, and that was about the time that the child that was suspect was sent home. And are you worried about being in public and not being quarantined, or Mr. Andrikopoulos?
Well, I actually asked that specific question to the superintendent, and he said based on the length of my stay and what I did there, I essentially came in, gave a short address, and left, that he did not feel that that was something that warranted. But he said, but certainly if you start showing symptoms, that would be a different story. So I asked that same question because I had the same question, as did Mr. Andrikopoulos.
You know, the other question I have is, it's been about 7 days now. The incubation period is approximately 7 days or around there. And the kids that are going on this trip now, none of them are ill. And my question is, why can't they go on the trip if they haven't come down with any symptoms?
Again, our guidance is anchored in the recommendation from Centers for Disease Control in contact with the State Division of Public Health. You know, the incubation period can range from 7 days, or an individual could be sick longer, or it could take more days before you recruit those illnesses. The steps that we've taken are a precaution, and they are a prudent precaution. We live in a global community. Certainly disease is circulating here, disease could be circulating anywhere. But the advice and the counsel that we've gotten from our public health partners is that 14 days would be the minimum. We will reevaluate that. In the interim, those impacted who could have come in contact for their safety and for their longevity and their health, it is important they take the advice of the advice that we've gotten from healthcare professionals at the CDC, state, and this health department. So while it is a concern that plans have to get changed, protecting the public's health is never easy, but it is always necessary.
So is it the plan now that the schools, all 21 are closed for at least 6 days, and then the
What we
decision
want
will
to
be
do is
made on?
we want to be reasonable, and we understand that families are being impacted by this. And my advice would be that in all probability, these schools will be closed all week. Do I hope that during the course of the week, the Centers for Disease Control come back to us and say we've reevaluated based on severity and based on an analysis, and we want these schools reopened? I'd be the happiest guy in the world. The students might not be happy. I'd be the happiest guy in the world to have that guidance coming from the Centers for Disease Control. Again, I want to reiterate, I do not view these as political decisions. We are trying to ground these decisions based on the guidance we're getting from the Center for Disease Control. But for expectation purposes, I think it's reasonable for parents to start planning for these additional schools and the schools we have previously announced to deal with the issues that they have to deal with during this week.
For at least a week, you're
For this
saying?
week.
Okay.
Now, again, I'm holding out hope. Hope springs eternal, that something will change that will allow us to come back sometime during the course of the week. But I don't want to create false hopes either.